If you're experiencing UTI-like symptoms, yeast-like symptoms, or painful sex and your tests are coming back negative, you probably had pelvic floor dysfunction. In this video, I'm going to explain what pelvic floor dysfunction is, how you developed it, and what you can do to treat it. Most people do not know that they have pelvic floor muscles until something goes wrong. So to give a little bit of an anatomy lesson, the pelvic floor muscles run from your pubic bone back to your tailbone. They support your pelvic organs and are also responsible for urinary, bowel, and sexual function. When these muscles are functioning properly, we don't have to think about them because they have autonomic features. This means that there's automatic things that are happening. For example, as your bladder is filling, the pelvic floor muscles will tighten so you don't leak urine. As gas or stool enters the rectum, the pelvic floor muscles tighten so you don't lose control of your bowels. During an orgasm, the pelvic floor muscles contract up to 64 times in a minute without you even having to think about it. Now, we also have the ability to control our pelvic floor muscles. The things that you probably most heard of commonly are Kegel exercises, where we're actually squeezing the pelvic floor muscles. When you go to use the restroom, you naturally relax the muscles to initiate your urine stream. So those are two different examples of what the pelvic floor muscles can do. Pelvic floor muscles can contract and pelvic floor muscles can relax. Because people don't realize they have pelvic floor muscles, the first thing that happens when you start to get these irritated urinary symptoms is to think, oh, I have a UTI. Of course, everyone knows what a UTI is. You have urgency, frequency, and pain. You go to the doctor takes your urine sample, it comes back negative. Well, if it's negative, why does this hurt so much? You still are having difficulty with urinary frequency and urgency, and your doctor's telling you you're fine? What the heck? So maybe your first doctor didn't know what was wrong, so let's go see the gynecologist. You go to the gynecologist, you get all those same tests again and a pap smear. Wait a few days, everything comes back negative, you still don't feel good. This is where the pelvic floor muscles can come into play. The muscles of the pelvic floor can actually create the same sensations as a urinary tract or yeast infection. Here's how they do that. They surround the urethra, and if they're tight, they can compress the urethra, making you feel like you have to go to the bathroom when you don't. Because these muscles are compressing the urethra, you also may not be able to empty your bladder fully, which can create a sensation of needing to go to the bathroom, otherwise known as urinary urgency, when you don't actually have the liquid in your bladder. They also surround the opening of the vagina, and therefore can lead to irritation, itching, and rawness if they become tight and dysfunctional. The tests are negative. The muscles can create the same sensations in the absence of infection. So when the tests come back negative, people are understandably super concerned because you don't feel good. So people start Googling their symptoms and they're looking online. They may stumble across the fact that pelvic floor dysfunction can cause these same symptoms as a urinary tract or yeast infection. So then people are wondering, well, what do I do now? Unfortunately, you can't see a regular physical therapist to help you with these types of symptoms. You need to see a pelvic floor physical therapist who has advanced training in managing pelvic floor disorders. I've linked a bunch of these resources in the description below to help you. All you need to do is enter your zip code and you're all set. Pelvic pain is way more common than people realize. So if you are struggling with pelvic pain symptoms, I want you to know that you are not alone. I'm going to be posting these videos as resources, so please feel free to check in or subscribe. And if you have any questions that you would like me to answer, please leave them in the comments section below.